All right. Good morning, everyone. My name is Allie Singer Wright. I am the program director for the Virginia Mental Health Access Program with the Medical Society of Virginia Foundation. A couple of housekeeping notes before we jump right in. It is going to be a larger webinar meeting this morning, and we have a lot of our partners and stakeholders and community members on the phone. There will likely be questions throughout the meeting, so if you could please look into your Zoom webinar box and use that Q&A function at the bottom. That will be our way to answer your questions. We're going to try to answer them throughout the presentation. We might have some time at the end. Again, we ask that you keep your questions to the topics that we're addressing today, but certainly if you have questions about anything else related to VMAP or have any questions after the fact, we're always available at info@vmap.org. Next slide, Taylor, please. Perfect. Now with that out of the way, it's time to start. I'd like to begin by welcoming the Virginia Mental Health Access Program's Medical Director, Dr. Sandy Chung. She is the CEO of Trusted Doctors, a pediatric group with over 122 providers in 22 locations in Northern Virginia and Maryland, and CEO of Health Connect IPA, a primary care clinical integrated network of over 200 providers, also in Northern Virginia. With 20 years of pediatric experience, Dr. Chung is active in multiple state and national organizations with a focus on mental health advocacy and health information technology. She is also the medical director of informatics of the Pediatric Health Network, member of the Connect Virginia Governing Board, and member of the Early Childhood Foundation Board. She is immediate past president of the Virginia chapter of the American Academy of Pediatrics, past chair of the board of the Virginia Foundation for Healthy Youth, and past president of the Medical Society of Northern Virginia. She's an associate professor at VCU's School of Health Sciences and Georgetown University School of Medicine. We are very lucky to have her. And now with that, I will hand the virtual microphone to you, Dr. Chung.
Thank you. I thought we weren't going to do long introductions, but thank you for that. I appreciate it. Good morning, everyone. Thank you so much for taking time out of your busy days to hear about VMAP, our progress, and our future plans. We're so excited today. We have several esteemed speakers who will be also updating us on the status of pediatric mental health programs in their agencies and organizations throughout this morning. First, I wanted to just take a few minutes to recognize that a lot of you on this phone call meeting, Zoom meeting, have participated in VMAP, volunteered hours, and without you, we could not have VMAP. So thank you so much for all of the time that you've spent helping this program become reality. We do know with the pandemic that pediatric mental health has unfortunately been exacerbated. Mental health for everyone really has been an issue, and we can at least be rest assured that with VMAP we're addressing the needs of the youngest and the most vulnerable to long-term consequences to mental health disease. So thank you so much again for being here. I do want to kick off our meeting today by introducing our first speaker. I'd like to introduce Nina Marina. She is the director of the Office of Child and Family Services at the Department of Behavioral Health and Developmental Services. She's been instrumental in being our lead at DBHDS, and DBHDS is where we receive our state funding. So without any further ado, Nina, please go ahead.
Thank you, Dr. Chung, and good morning, everyone. Welcome to our annual stakeholder meeting. I want to thank everyone for another great year as champions of VMAP. It's really exciting to think about where we were this time last year and how much we've accomplished over the past year. I'm very thankful for all the talent that surrounds this program, the stakeholders, our work group members, providers who are using the psychiatric consultation line, our VMAP staff, the child and adolescent psychiatrists, our executive committee, and our contractor, the Medical Society of Virginia, for all helping to bring this program to life for children and adolescents in the Commonwealth. And also just a big thank you to Bernadette Knight, who works as our state contract administrator at DBHDS on this program. It's really rare and special to see so many people come together so quickly to make something like this happen that can have such a big impact on young people across the state. This time last year, we were in the process of soliciting a vendor to help organize and bring this program together. And now a year later, we have 2 hubs, one in the Eastern region and one in the Northern region that are up and running. We've had over 425 consultations, over 300 providers trained to date. Most of this has happened during a pandemic that we know has caused hiring freezes, delays in funding, drops in pediatric visits, and a host of other disruptions to business as usual. You add to that the social and racial unrest due to systemic racism and police brutality. You sprinkle in a presidential election, and it is rather outstanding to think about what we have actually accomplished in 2020, which has been quite a year for all of us. So what we are doing is so important, and I just wanted to share some statistics on how youth in Virginia are doing, as well as some other initiatives that are happening in the Office of Child and Family Services at DVHDS. So according to data from VDH's Youth Risk Survey in 2019, 16% of high school students reported that they had their first drink before age 13. A quarter report currently drinking alcohol, and 17% currently use marijuana. That same survey indicated that 10% of middle school respondents indicated that they've used prescription pain medication without a doctor's prescription. In terms of mental health, still over half of youth who have a major depressive disorder diagnosis do not receive any treatment in Virginia. And the most recent data from the Youth Risk Behavior Survey showed that 16% of high school students and 21% of middle school students reported seriously contemplating suicide. And what is most concerning about that data to me is that while the rates of reported suicide attempts have gone down with high school students, we're actually seeing the opposite trend with middle school youth. So this should give us all some pause when we think about kids in that age group in terms of increases in some substance use, as well as increases in thoughts and feelings of suicide. All of this data is pre-pandemic, so we don't yet know the impact of COVID on these trends. But what we do know is through a national survey that was conducted this summer of over 3,000 high school students, almost all of them reported that they were attending some virtual schooling, 92%. But what was concerning is that 3/4 of them reported spending 4 or fewer hours each day in class or working on assignments. And since school has gone virtual, 30% of young people say they've been more often feeling unhappy or depressed, and nearly as many say they are much more concerned than usual about having their basic needs met. More than 1/4 of these students say they do not feel connected at all to school adults, and a similar percentage said they don't feel connected to their classmates or their larger school community. So taken together, this is very concerning in terms of risk factors for youth that might be struggling with mental health, substance use, or physical and emotional safety. So when we kind of take all of this together, what we have to kind of think of here is that this is really a collective trauma that youth across the country are experiencing, and that the impacts of this pandemic will likely be felt for years to come. So I know these statistics are grim, but this is why a program like VMAP is so critical to earlier screening, treatment, and referral, while reducing stigma, which we know is often a barrier for treatment. Many families don't feel comfortable seeking out kind of specialty behavioral health services, or many don't even know where to start, but they will talk to their providers about their concerns. And now our providers have some additional tools in their toolbox and are better equipped to respond to these needs as they arise in their office. So we do see VMAP as one of what will need to be many responses to COVID on the significant impacts of behavioral health due to COVID-19. And in fact, we know our pediatricians are already seeing these secondary mental health impacts of the pandemic firsthand in their offices. So kind of more broadly, how is our office responding and what have we been focused on over the past year? So several things. We're continuing to support the infrastructure for evidence-based practices in mental health through a new collaboration with other state agency partners and VCU to develop the first ever Virginia Center for Evidence-Based Practices that will help with workforce development, a centralized database for certified EBP providers, as well as quality outcomes and evaluation. And we're entering into our final year of a youth substance use treatment pilot that has served over 287 adolescent and transition age youth to date, using an evidence-based practice called the Adolescent Community Reinforcement Approach. We have 4 CSB grant partners we're working with. We've worked to strengthen our children's crisis system with the implementation of more mobile crisis teams specific for kids under STEP Virginia. Our office is also launching a new project to create the first statewide training that will ensure all mobile crisis workers across the state are receiving a set of core competencies and a universal framework. Our early intervention program that provides services and supports to to infants and toddlers under the age of 3 who are not developing as expected, have shifted, like many of us, to a virtual service delivery model using telehealth. Hello?
Sorry, Nina, we lost you just for a second, but you're back now.
Oh, okay. I'm not sure at what point I got lost there.
The last word you said was telehealth.
Oh, well, that wasn't very long ago. So sorry, guys. I don't want to take up too much more time, so I'm just going to skip ahead here a little bit. But the last thing I want to say is in response to the impacts of structural and systemic racism on communities of color, our office, in partnership with the VMAP Executive Committee, has committed to ensuring that all youth who have an identified behavioral health need can benefit from a program like VMAP. And to that end, we've created a blueprint for our commitment to addressing the impact of racism on Black, Indigenous, and youth of color, as well as historically underserved populations. So we're excited that we are embedding this framework early into the program. There'll be more information on this over the next several months on what these strategies will be. For folks that are interested, you can look at both of these health equity statements on the VMAP website right now. So we've clearly accomplished quite a bit. We're still at the beginning of this journey, but thanks to the reallocation of funding that was previously passed by the General Assembly last year, after being introduced in the governor's budget, we're going to be able to expand VMAP statewide. So I look forward, and we all do, to what 2021 will bring. So now I'm going to turn this over to our commissioner at DBHDS and just do a quick introduction. And hopefully,
can you confirm that Commissioner Land has joined?
She has.
I have.
Great. I just wanted to double check. I wasn't sure.
Okay. The fun of virtual meetings, right? So.
No visual.
Allison Land was appointed by Governor Ralph Northam in December 2019 to serve as commissioner for the Virginia Department of Behavioral Health and Developmental Services. We operate 13 hospitals and facilities with over 6,000 staff and provide strategic direction, financial resources, and oversight for Virginia's publicly funded system serving individuals with mental illness, substance use, and or developmental disabilities. Before her appointment to lead DBHDS, Ms. Land served since 2015 as the Vice President for Behavioral Health Services for Sentara Healthcare, responsible for coordinating and implementing initiatives that improve access, quality, and efficiency in both inpatient and outpatient settings within behavioral health. So with that, I'm going to turn it over to Commissioner Land. Thanks.
Thank you, Nina, and thank all of you for welcoming us here today. I do want to follow up Nina's remarks by sharing with you updates on some of our behavioral health priorities here at DBHDS. As you heard Dr. Chung and Nina say already, and as we all know, this is a truly incredibly challenging time for our Commonwealth and our country. And that's why it's more important than ever that we're providing the essential behavioral health services that Virginians rely on, and especially at this time when they need them most. COVID-19 has truly tested Virginia's behavioral health system, requiring our state facilities to go above and beyond to ensure proper infection control, and forcing our community partners, including Virginia's 40 CSBs, to prioritize essential services such as pre-screening, pre-discharge planning, and diversion from inpatient hospitalization. Additionally, we've had all of us to pivot towards telehealth, and we have done that miraculously. The pandemic has upended our social connectedness in significant ways, and there's been an unprecedented increase in screenings for depression and anxiety. I wanted to share that Mental Health America has reported that those under age 25 have been very impacted by the pandemic, with roughly 9 in 10 screening with moderate to severe depression and 8 in 10 screening with moderate to severe anxiety. The number of youth that are experiencing, I apologize. The number of youth that are experiencing major depressive disorder increased by almost 100,000 across the country since last year's data set. And in Virginia, this represents about 13% prevalence in youth, or around about 83,000 Virginia children. VBHDS, in partnership with the Virginia Academy, American Academy of Pediatrics, and the Medical Society of Virginia, have conducted a statewide survey of pediatricians, family medicine physicians, and family nurse practitioners to try to understand the behavioral health impacts of COVID-19 on children and adolescents who have been seeking primary care services. Of the nearly 150 survey respondents, 88% said more of their patients are presenting with mental health symptoms since COVID-19 began than previously. Close to 80% of the primary care providers reported that since March of this year, compared to the same time last year, that they're seeing anywhere from a slight to moderate increase of up to 30% in mental health issues in children and adolescents that they're treating. Some of the top presenting issues that they've responded to are increased anxiety, depression, and behavioral issues that were not present before the pandemic began. And these span across developmental age range for children. Social isolation, loneliness, and parental stress related to COVID-19 access and access to the child psychiatry services ranked as the biggest mental health need. I'm sorry, I'm having an issue with my computer slide. I'm stopped in my tracks. Hold on for just 1 second. I do apologize. And it's not just there, it's on my phone too. Let's try this again.
While Commissioner Land works on her slides, I just wanted to remind everyone that we do have a Q&A function, and as part of the webinar today, all attendees are automatically muted, and there is no opportunity for video, but we do want to make sure that we're able to answer your questions and connect with you. So that Q&A box is a great way to do that, and we'll be answering those questions throughout and towards the end.
Okay, I'm back in business. I apologize. So as I was saying, that as the pandemic continues, we anticipate the need for behavioral health services to rise as Virginia deals with the physical, economic, and psychological impacts of COVID-19 and what that's having on everyone's lives. At the same time, our existing challenges like the hospital bed census, behavioral health transformation, and the critical need to increase access to community services, especially for children, have not gone away. And we must find a way to address them while also prioritizing the care and safety of the people we serve and our frontline workers during the ongoing pandemic. I'm now going to share how we're continuing to do just that. So from STEP Virginia perspective, and for those of y'all not familiar with STEP Virginia, that's an effort to transform Virginia's public behavioral health services system in a strategic manner. And VBHDS worked with the administration, the General Assembly, and other stakeholders to build STEP Virginia, which stands for System Transformation and Excellence and Performance. It's a framework for ensuring access, consistency of services, quality of care, and accountability in Virginia's public community services boards. STEP Virginia requires all of our CSBs to provide the same services, such as same-day access, primary care screening for all patients, outpatient services, or mental health and addiction treatment, targeted case management, crisis services, and other critical services. Services for all age groups and veterans are integral to the model. Same-day access and primary care screening have already been launched, and efforts are underway to expand outpatient services, mobile crisis, and the crisis dispatch. During fiscal year 2020, we've received some data, and we had almost 61,000 same-day assessments reported statewide. We also saw just under 78,000 primary care screens completed. And there are also just about 35,000 metabolic screens were reported. During COVID, these services are being provided using drive-up services, symptom screens, and telehealth, a lot of telehealth. It's really gone virtual. Originally, the 2020 General Assembly provided funding for the military services and peer steps of STEP Virginia and additional funds to expand the crisis system. They were initially unallotted, but were restored in the special session, and we're very, very thankful for that. The peer and family support step focuses on the peer workforce being integrated into the range of CSB services and sustainability of that workforce, making sure that they're getting training, certifications, and maintaining quality. STEP Virginia is our path to bringing Virginians the robust, accessible, high-quality community services system that they deserve. And as we move forward, we are fully committed here at DBSCH to build out all of these STEP Virginia services. I want to talk a little bit about adverse childhood experiences, or the ACEs, and other prevention work. ACEs are potentially traumatic events that can have negative, lasting effects on health and well-being. This adversity can harm a child's brain and its development, which results in long-term negative health and social outcomes. ACEs may be quite common, but they are preventable. DBHDS is raising awareness of ACEs in local communities through education and community mobilization to prevent and reduce the impact of childhood trauma. We've developed new virtual trainings on ACEs and have trained about 2,000 people since May to better equip providers to treat and help children who've experienced trauma. There are other important prevention activities geared towards children. For one, community mobilization and development of coalitions is the key to reduce the risk of exposure to alcohol, tobacco, and other drugs by underage youth, and Nina talked a little bit about that. Also, through Youth Mental Health First Aid and regional suicide prevention coalitions, we're working to develop community member skills to identify a young person who may be experiencing mental illness or thoughts of suicide, and then link them to the appropriate help. We're also continuing to expand our work around substance use prevention. Nina spoke a little bit about that as well. Earlier this year, Virginia was awarded nearly $52.6 million in state opioid response, or SOAR, grants from the U.S. Substance Abuse and Mental Health Services Administration. These funds will help Virginia fight the opioid epidemic and stimulants from October 1st of this year through September 30th of 2022. So we have a good bit of options and time to work through and make sure that we use those funds to the best of our ability. These funds will be distributed to localities to support prevention, treatment, and recovery efforts administered by Virginia's community services boards. They will also help support the work at state agencies, expanding naloxone and peer recovery services, medication-assisted treatment, and collegiate recovery programs at Virginia universities and colleges. Virginia previously had received just under $40 million in SOAR funds in October of 2018 to fight the growing opioid crisis. Those funds have been infused into communities across Virginia and so far have resulted in substance use disorder treatment services for over 4,000 people and also recovery support services for over 10,000 people. There have also been just under 6,000 kits to administer naloxone to help prevent overdoses, and 8 collegiate recovery programs added statewide. Grant-funded programs also include increasing access to effective medication-assisted treatment programs, building telehealth strategies in rural and underserved areas, and strengthening treatment transition for people. Taking a drink of water. Also, earlier this year, the SOAR funds were used to launch a multi-agency redesigned Curb the Crisis website to help those seeking information and treatment. I encourage you to visit the curbthecrisis.com and also connect with Curb the Crisis on Facebook and Instagram. We have a great deal of work ahead of us, but the transformative initiatives we are all working hard on, like VMAP, will lead to a more consistent, robust, and accessible community services system that will hopefully reduce psychiatric crises, emergency department visits, avoidable incarcerations, and admissions to state hospitals. At the same time, we know the ongoing pandemic will continue to challenge us and put strain on our systems, and most importantly, the people we serve. I hope that as we all focus on that central mission of service to Virginians who rely on us, that we remember to care for ourselves and those around us that are also doing the work. I do want to mention before we end that since June, we've been working with Mental Health America of Virginia and our CSBs to operate a COVID warm line called Virginia Cope. Individuals who are struggling with stress, anxiety, isolation during COVID-19, that has brought so many lives into anxiety. But they can call or text 877-349-6428 and speak to a trained crisis counselor who will engage in active listening and can provide information on community services as well as referrals to behavioral health services if needed. The Virginia COPES line also has bilingual counselors available, and the counselors have reported that over the last few months, they have received calls not just from adults, but from adolescents and teenagers, and we are grateful the warm line could be there for them. As we head into an unusual and potentially difficult season, we know this will be a much needed resource for individuals, and we hope you will help us to spread the word. Again, that number for Virginia COPES is 877-349-6428. We've accomplished much through collaboration with stakeholders and leaders such as you, and I'm grateful for your partnership as we work together on behalf of thousands of Virginians on their path to recovery. It's my hope that when I join you next year, we'll have much, much more to celebrate. Thank you so much for having me today.
Thank you so much, Commissioner Land, for joining us and for Nina and providing key updates from your agency. We're very fortunate to have DVHDS as our key partner for making VMAP possible. Now I'd like to shift to our other partners at the Virginia Department of Health. We're going to start with our HRSA Program Director for VMAP, Bethany Geldmaker.
Good morning. Thank you, Allie. As she shared, my name is Dr. Bethany Geldmaker, and I serve as the project director for the HRSA-funded VMAP portion of the project. This is a pediatric mental health care access program. The 5-year grant was awarded in 2018 as a unique partnership between public health and behavioral health in response to the public health crisis around mental health needs in children. It annually provides $445,000 in support of the project and currently runs through 2023. And that is helping us as we move forward with sustainable funding. The funding actually served to conceptualize the underlying framework of 4 pillars, which included education, community support, care navigation, telehealth, and workforce expansion, as well as to build out the 5 regional hubs. The Department of Health has a long history of partnering to protect the health and promote the well-being of its citizens. And I'm pleased to introduce our Commissioner, Dr. Norman Oliver, who's going to share how we're supporting the well-being of children's mental health. So Dr. Oliver is the State Health Commissioner at the Virginia Department of Health. And prior to this appointment, Dr. Oliver served as the Deputy Commissioner for Population Health for VDH. Before accepting the Deputy Commissioner position, Dr. Oliver was the Walter M. Seward Professor and Chair of the Department of Family Medicine at the University of Virginia School of Medicine. He worked with others in the health department, other state agencies, and healthcare systems across the state to improve the health and well-being of all citizens of the Commonwealth. He's committed to a cross-agency and multi-sector approach to implementing population health initiatives, including health equity, and as you can see today, our VMAP project. Dr. Oliver attended medical school at Case Western Reserve University. He also obtained his master's degree in medical anthropology and trained in family medicine at Case. He then practiced broad spectrum family medicine in rural Alaska for 2 years before joining the University of Virginia Department of Family Medicine in '98. I want to thank Dr. Oliver for joining us this morning to share what Virginia Department of Health is doing to support children's health and mental health. Thank you.
Thank you very much for that kind introduction. Is my sound coming in okay? Okay, wonderful.
Sure is. Thank you, Dr.
Virginia is, as you've just heard from a number of the prior speakers, facing a really unprecedented health and economic crisis with the current COVID-19 pandemic. This pandemic and the trauma that it has spawned has increased emotional and psychological distress in all of us, and it's had obviously an impact on youth in the Commonwealth as well. Children's daily routines, their learning, their social experiences have been changed dramatically by this pandemic, and that change has been quite significant with, we know, serious negative impacts on those children and on the families of those children. VDH shares with you all very deep concerns about the rising inequities in this pandemic. As a number of people have also mentioned, these adverse effects are disparate across our many communities, and in Black and Brown communities and other marginalized communities, it is clear that these bad impacts are even worse than they are in other communities. VDH closely monitors the actions, policy, and funding priorities that are required to support maternal and child health at the community and at the state level. And we've been very active in partnering with many of you in, for example, the realm of mental health. The goal of promoting mental health across maternal and child populations is really a central one for VDH. We've been very supportive of VMAP and will continue to be an active partner with VMAP in dealing with the healthcare providers of the Commonwealth and providing them with the support that they need in tending to the emotional and psychological health of children and adolescents. The other way in which we've been active around mental health has been through Project Patience. In 2018, the Virginia Division of Health, Injury, and Violence Prevention Program developed Project Patience, which is an injury prevention education toolkit and technical assistance initiative designed to equip professionals teaching injury and violence prevention to newborn caregivers. And it's an important thing that we do, as well as things like our home visiting programs through VDH. You all may be well aware of the maternal, infant, and early childhood home visiting program that we carry out and help to lead, as well as our work with baby care, resource mothers, Healthy Start, and others who are tending to these early childhood interventions. We are active in youth violence and bullying prevention programs, as well as many suicide prevention programs. I would say that another big aspect of what VDH does is trying to develop cross-sector strategic partnerships to deal with these sorts of issues. One of the most important ones we've been involved in is something called Partnering for a Healthy Virginia. This is a broad-based, cross-agency, cross-sector coalition of many organizations, hospital systems, public health departments, many state agencies, including DBHDS and VDH, and as well as community-based organizations, philanthropies, and others that has joined together to really address population health needs in the state. And this is, of course, very, very important. We think that building strong systems of care for all children and addressing also the issues of the racial inequities that we see in the delivery of care is really important. And commend all of you in VMAP who've been working on helping primary care providers provide the much needed behavioral health services in their medical homes. I know, as Commissioner Land pointed out, that many primary care providers are seeing an uptick in those issues in their everyday clinic visits. That was always the case. I mean, I trained as a family doc, and I know that, you know, probably good 30–40% of what I saw every day in the clinic was the first complaint was some kind of behavioral complaint, and almost all the physical complaints also have an associated behavioral health component. This is a big issue in providing those pediatricians and others who are taking care of children and adolescents the tools and resources that they need to be able to deal with these issues in their clinic exam rooms and have the support and referrals that they source resources that they need is critical to dealing with what will be a problem for some time to come. I want to stop here in light of the time, and thank you all for giving me the opportunity to give some just support from VDH. Thank you for all the work that you're doing.
Great, thank you so much, Commissioner Oliver. We really appreciate you taking time out of your busy schedule. We know you're a little busy with COVID testing, COVID vaccines, contact tracing, and the like. So thank you so much for giving us a few minutes of your time. And I did want to express a particular thanks to you, Commissioner Oliver. I don't know if everyone knows, but about 2.5 years ago, I wrote to Commissioner Oliver and said, we're interested in applying for a grant for a program at the time wasn't called VMAP, but it was VMAP. And he said, sure, as long as my staff has time, that sounds great. and here we are. So thank you so much, Commissioner Oliver. So I'm going to start by giving us, before we get into the 2020 updates and our future planning, just a brief overview of VMAP, just so that everyone on the call has the same information. Next slide. So as we know, we have a workforce issue in our state. 77% of our localities are classified as mental health shortage regions, and we only have 13 child psychiatrists per 100,000 children in our state. That leads to long wait times of 4 to 6 months before patients can get care. And so because of that, often the primary care providers, the pediatricians, family practice docs, nurse practitioners, and PAs are the ones that have to provide that mental health care. However, when there was a national survey of pediatric providers, 65% of pediatricians reported that they did not have the skills or knowledge to manage mental health conditions in their offices. Next slide. So our answer to this is VMAP. And so VMAP has 4 pillars, as we've mentioned before. And just to do a quick review, we have an educational pillar. This is where primary care providers are taught how to better manage and screen for diseases such as ADHD, anxiety, and depression, and other mental health conditions. And then the second pillar is the child psychiatry consult line, or also now a consult line that also has licensed mental health providers on it. So with that, when primary care providers are treating patients, if they get to the point where they don't know what to do, they can reach out and call a specialist for advice. And it's nearly real time, and it allows us to take care of patients that are right in front of us. The third pillar of VMAP is telepsychiatry. This allows those psychiatrists or licensed mental health providers that are on the consult line helping primary care providers have an opportunity to see the patients directly. This pillar is still under development, but then what it would allow is the specialists to be able to get more information from the families themselves so they better know how to advise the primary care provider on what to do. And the fourth pillar is care navigation. This will help families find those important services in their communities for ongoing care for mental health. Next slide. So I wanted to introduce our VMAP Executive Committee. These are the leaders who meet every week and work tirelessly to make sure that VMAP is on track and meeting our mission. So you've heard from Nina this morning. Bernadette Knight is also from DBHDS. She's our VMAP State Program Administrator. You've heard from Bethany. She's at our Virginia Department of Health. You've heard from Allie. Mary Beth McIntyre is at the Medical Society of Virginia Foundation. You'll hear later from Rachel. She leads our call center and our care navigation work group. And then of course, myself. Next slide. VMAP is supported by multiple work groups, and though each work group has a leader, we are indebted to those leaders for doing the hard work that makes VMAP real. I wanted to just make sure you will hear from all of these folks today, but I just want to make sure that we recognize them. So the leader of our PCP education work group is Dr. Beth Ellen Davis. Our child psychiatry work group is Dr. Bella Sood. Our care navigation work group lead is Rachel Reynolds. Our telehealth work group is Tina Gustin. Our data work group is led by Bernadette Knight and Nika Anwell. And then we're so pleased to announce that we will be adding an equity work group. We are currently searching for a lead for this work group. So if you are interested, please, please, please let us know. Next slide. So how does VMAP work? So first of all, if you start in the bottom left corner, we start with educating primary care providers. And then as they see patients and they need assistance, they call our call center. That call center is located in Richmond. And then the call center will then direct the call to either the consult line or the care navigation line, depending on why the primary care provider is calling. And then if there's a need for a telepsychiatry visit, then that's incorporated as well. Next slide. We do require that the primary care providers register. This helps us track who's using the line and also ensures that we train and educate the primary care providers who are using the line so that we can maximize its efficacy. Next slide. And now I'll turn it over to Allie. Thank you.
Thank you, Dr. Chung, for a brief overview. I know many of our those on the phone today know a little bit, but we wanted to make sure we caught you up and ran through the program as it exists. Once again, I'm the program director for the Virginia Mental Health Access Program. I work out of the Medical Society of Virginia Foundation. And, you know, before we dive deep into what VMAP has done over the past year, we really wanted you to hear directly from some of our pediatric primary care providers from all over Virginia, talking about their experiencing using VMAP, their experiences, and sharing how the program has impacted them.
So I actually used the consult line just last week. And, you know, while the REACH training and, you know, my 12 years in primary care pediatrics as a physician have given me a lot of tools, I had a patient who I was just over my head. And before the consult line would have been available to me, I would have had to send this child to the ER. So to let you know a little bit about this kid and family, this is a child who's been in and out of the psychiatric hospitals 6 times in the last 2 years. Most recently, I am in Roanoke, Virginia. He was admitted to a hospital at Virginia Beach. So 3 weeks ago, this child was discharged to home from Virginia Beach. Their first psychiatrist appointment, because they don't have a local one, he's been in the hospital so much, isn't until 2 weeks from today. He was on 5 medications and hallucinating. He was safe at home, wasn't suicidal, so did not have a reason to be admitted to the hospital again. I was able to call the consult line within an hour, talk to a psychiatrist, and I had a treatment plan. And I called the kid's mom back. She was on her way home because she lives an hour from me in a rural area of the state. And we established a treatment plan, and I'm going to see them back later this week. And that is care that I could not have provided without the consult line. I would have been over my head. I wouldn't have known what to do. Also thinking about what is VMAP doing for us in primary care. There is a real burnout that I've seen happen, I see happen with my colleagues in primary care, where we feel like we know we need to address a need and we may not know how to.
I've been so thankful that VMAP has been there doing the consultation lines. They are responsive very quickly. I get phenomenal advice. I am much more comfortable. I feel like my patients get so much better care by getting advice from VMAP than if I had referred them to a general psychiatrist, somewhere within an hour from here. And I feel my patients are much better cared for. And when I need to get help and do a referral, I still have trouble finding somebody to do a referral with, but I feel like the patient's under good management until that can happen.
Especially when it comes to any need for medication, there is just such a long wait, issues with insurance and so on. And so I just felt like my hands were tied. Now, with VMAP, I feel like I have been able to bridge that gap. And that, has been really, really meaningful. Being able to have, more of an education and background in how to manage these medications. And then when we are limited still in our knowledge set, to be able to call the psychiatrist and get, that feedback to intervene has been just a huge lifeline to basically bridge that gap. These families would be just waiting for months and months without any help otherwise.
But luckily, the VMAP program was there. One of the prongs of the VMAP program is education. And through the education prong, I've been learning a lot about how to screen for depression and anxiety in adolescents and how to manage it and treat it.
I remember my very first mental health patient that I took care of as an attending. And this patient came to me in a checkup and she was severely depressed, getting to the point of being suicidal. And I knew that I needed to do something now to help her. So I walked out of the room and went over to one of my colleagues who I know does a lot of mental health and has prescribed a lot of medication. And I was like, I need help. And they handed me all of these different tools that I could give this patient, walked me through some basics about how to start the medication. And I did all of those things and I felt, wow, I think it just really helped this patient and made a big difference. I don't feel comfortable doing this at all on my own, but it's here and I'm going to have to do this. We got to take care of my patients. So I was very fortunate to be given the opportunity to participate in the REACH conference within a few months of being an attending. And it was offered free of charge for many of the people that are in my local community. Several people from the practice where I was working, we all went together, and it was the most impactful CME course I have ever had. I walked out of those 3 days and transformed my entire practice. I started screening more readily for mental health concerns at every single checkup. I felt more comfortable evaluating patients and diagnosing them with things outside of just ADHD, but really getting into more anxiety and depression. I started doing a lot more medication, getting a lot more comfortable with all of that. And now I can definitely say that mental health is a very large part of my practice. And I see patients every day, treat patients every day. And VMAP has been extra helpful at this point because I feel quite comfortable with a lot of the kind of straightforward issues. But then when it gets a little bit more complicated, it's amazing to be able to pick up the phone and get in contact with a psychiatrist and get advice that then I can use not only for that patient, but for when I move forward and take care of other patients.
About a year and a half ago, I did my first conference with Project Echo, the year-long group. And so I just completed that, I want to say August of this year. And after that, immediately signed up to do the deeper dive for the younger kids between 0 and 5. And then was connected to the REACH conference as well, which myself and one of the physicians at our practice just completed. And so I feel like I've learned a ton. I feel like my skills have grown because of that. It was great to hear from not only psychiatrists, but also from pediatricians. I feel that my understanding of a lot of these conditions, ranging from depression to bipolar disorder, has grown, and I know that my comfort level with more complex conditions has grown. And then more recently, I've been able to also use the VMAP line for one of my patients that unfortunately is unable to follow through with psychiatry appointments. And so we have been managing his condition, and I feel like he's tried more medicines than any of my other patients. And I was able to reach out to a psychiatrist through VMAP, and they called me back in like 5 minutes and gave me some recommendations for what to do when he comes in next.
I just wanted to take a moment to thank those providers for talking with us and sharing some of their experiences firsthand, really sharing how VMAP's making a difference for them in their day-to-day work. So rewinding a little, how did we get here? I wanted to run through a brief history of the program. I know we heard from our Virginia Department of Health partners. That's where we started. We started with a small but mighty HRSA grant to the tune of $445,000 a couple years ago. And this really got the consult line off the ground. It established our call center, and it got our educational programming started. Then in 2019, the Virginia General Assembly gave VMAP state funding to start growing and expanding specifically into 2 regions of the state. Then in 2020, we were fortunate enough to get more funding from the State General Assembly. This funding's purpose was to fully expand throughout the state. However, we know that because COVID happened, most of us on the call here remember our VMAP's funding was frozen. And then we had our special session in late summer, early fall. And fortunately for the Virginia Mental Health Access Program, our funding was reallotted during the special session. We're very thankful to all of our partners and allies and legislators, many of whom are on this call today, who really helped to keep pediatric mental health and VMAP a priority during the special session. Since COVID has started, we know that VMAP is now needed more than ever, and we were successful in communicating that to the legislator late this summer. Next. And the way this new funding is going to be coming towards the program, based on where we are in the state fiscal year, the state has said that we will get half of the funding for VMAP through the end of their fiscal year, which ends in June 2021. And then starting in July, we'll have the full amounts from the state to expand statewide. So you can see for FY22, we'll have that full amount from the state. But as you can see, VMAP isn't just funded through state and federal funds. We also receive generous grants from organizations and entities like the Jenkins Foundation, Cigna, Healthy Minds of Fairfax County. And we really couldn't be more appreciative of all of this support that's made VMAP possible. So a lot has happened this year. 2020 has been a really big year for VMAP. When our state funds came to the program, the Department of Behavioral Health is who those funds come through, and they named the Medical Society of Virginia Foundation the contract administrator of the program. That happened in January, and the primary goal of the Medical Society of Virginia Foundation is really to continue and expand VMAP services throughout the state as the official contract and program administrator. Our first order of business was expanding that psychiatrist consult line that you've now heard a little bit about. It was part-time, and this summer we were able to get that consult line expanded to 40 hours a week so that primary care providers from anywhere in the state are able to call during normal business hours and receive a consult from a psychiatrist. Another thing we did this year was we actually expanded the age range of the patients we serve. So through age 21 now, VMAP will support PCPs with their patients who are through age 21 up until that 22nd birthday. We also got a new URL. It maybe sounds small, but it was very exciting for us. And so we are vmap.org, and a couple of new important things on our website. We added the feature for primary care providers to request a consult online. So instead of calling the call center, they can fill out a brief form right on our website to initiate that consult process. We also published our very first annual report. It's also available on our website, and we have it printed as well. And then we made two important statements around areas of prioritization for the program. The first was a statement on racism, recognizing racism is a public health issue and it can lead to poor health outcomes for youth of color. And consequently, VMAP is striving to ensure that youth of color in the Commonwealth receive equitable and high quality mental health treatment. The second statement was a broader health equity statement that spoke to VMAP's priorities around improving access to mental health services for youth living in underserved areas and communities throughout our state. Next slide. Probably the biggest news of 2020 is that VMAP started its very first regional hubs. So a fully staffed regional hub is made up of a full-time regional-based psychiatrist, a full-time licensed mental health professional, either a LCSW or a psychologist, and then one or more care navigators, and those are meant to support with resources and referrals that primary care providers might need, additional support outside of the primary care setting. We'll talk a little more about those roles in a bit. So right now, and previously, we had psychiatrists from all around the state supporting with the consult line, but we're really working to shift to a regionally focused model. And thanks to our partners at Inova and Children's National Hospital, we were able to pilot adding these new services to our consult line in the northern region. We did that just last month. We went live with having licensed mental health professionals and care navigators on the consult line. So now if you're a primary care provider in the northern region of the state, your call is going to get routed directly to your regional hub where you're going to have access to a psychiatrist, a regional licensed mental health professional, and care navigation services. We're also working on doing the same thing. Our kind of next step is doing this in our eastern region. This is through our partners at Children's Hospital of the King's Daughters. Right now, we have our care navigator and licensed mental health professional have been hired. They're being onboarded, and we hope to go live with those services early next year. Next slide. With that being said, I'm now going to hand it off to our call center manager and care navigation lead, Rachel Reynolds.
Thank you, Allie. So I get the pleasure of presenting a number of slides that are going to share some of the great work we've been doing over the last year, almost year and a half. So we'll go to the next slide and start things off. So as Allie noted, we did some significant expansions this year. We initially launched the call center line in August of 2019 and made those expansions with both the age range and the availability for consults this year. So we're really excited about that. This past October, we also completed a major update to our data collection workflow. And so this is really allowing for several improvements as we bring on the licensed mental health provider services and care navigation services that we're launching in all of the hubs. So that started officially in November of this year as well. We did see some impact as a result of COVID-19 to our call center line. We saw a significant drop in our consult requests from April to July. But as you'll see in some of the following slides, we have seen a steady increase since August in the usage of the call line, and we're really excited about that. So next slide. So in total, between the start of the call center line in August of 2019 and through October 31st, we have had 367 providers and 119 practices officially register with VMAP. We have provided over 426 consults, and that represents 396 unique patients who were served via those consults. Next slide. So this, it will show you kind of that flow with our consult volume. The slide on the left is, or the graph on the left is our total consults, and then you can see the unique patients that are supported. We do have some providers who have called back regarding patients for follow-up questions, whether it's after a day or after 2 weeks or after 2 months. So that's been a really important thing that we're able to offer. And you can see that dip that we took from April to July, but we have been steadily, actually more than steadily, increasing that call volume. And as an aside, I just want to note that this week in particular has been the busiest in VMAP to date. We've had 24 consultations in 4 days. Almost all of those have been in the northern region. And so I want to give a super shout out to Julia and Catherine, who manage our northern hub as licensed mental health providers and care navigators. They have really been stepping it up to help support all of this process and work with our psychiatrists to make sure that all of these consults happen. It's been a great week. Next slide, please. So we're going to share a couple of slides regarding the ages and the folks that we're serving. As you can see, the biggest age group that we're serving right now is that 15 to 18-year age group, but we're also seeing significant usage for children ages 11 to 14 years and even children as young as 0 to 5. And since we have been able to expand the age, 4% of our consults have been in that 19 to 21-year-old age group. So we're seeing that grow as well. Next slide. You can also see our provider enrollment by region. Again, it is really heavy in the northern region, but we know that we have a large population there and a lot of providers that we're serving. And particularly as we've been expanding out that northern hub, we see about 47% of our providers are from the northern region. We're also seeing great participation in all of the other regions in Virginia as well, though, and we're seeing that expand every week. Next slide. So one of the things that we are looking at in terms of outcomes is how is VMAP supporting PCPs and helping them serve patients within their practices? And you heard a little bit about that through those testimonials that the providers were able to give in the video earlier. But I think some of these numbers also really speak to that issue. Beginning in July of this year, we started asking a question of PCPs when they call for a consult. And that question is, what would you have done regarding this concern if VMAP wasn't available to you today? And 46% of them responded that they would refer the child to a specialist, which is our largest response category. There could be multiple responses. Then we also asked the CAP, or the licensed mental health provider, following the consultation about the outcomes of the consult. And for 87.6% of our consults, the PCPs are able to continue management of the patient within their practice, usually with additional outcomes such as continuing existing behavioral health treatments or referring to talk therapy or some other services. So that's really showing us that we are able through VMAP to help providers serve patients within their practices rather than having to send them to an emergency room or to refer out for a long wait for a specialist. And I just wanted to note statistically, if you're interested, about 7% of our consults have included subsequent consults or follow-ups for ongoing or new questions. Next slide. And I'm going to give a final note about care navigation. We've talked a lot in the earlier slides about what care navigation is and how it will be utilized in VMAP. We're just on the cusp of introducing these services and launch them in November of this year in our Northern Hub. I want to give some special thanks to the care navigation work group, because one of the big things we have done this year is develop the work competencies for the role of that care navigator. not just their job description, but what we really think a care navigator should know about their region and about the work that they do. And that is really going to guide these regional hubs as we launch the utilization of those roles. Our next hub to launch is the Eastern region, and that care navigator has been hired, and we're going to be really excited to bring that person on in December, so that starting in January, we should be offering full services in the Eastern Hub as well. And finally, we've talked a lot in the care navigation work group and in our executive team about options for a unified resource database that's going to serve care navigators across Virginia. And we have some leads on options for this, and I think we will have more information to report on this in 2021. So with that, I am going to end. Again, if you have any questions, you can put them in the Q&A and we'll answer them, but I'm going to hand this over to Dr. Davis, and she's going to discuss VMAP education.
Thank you, Rachel. I think we've heard today that the majority of practicing U.S. pediatricians and other child serving providers, even young ones, even new practitioners, even in our state, have stated that they don't have the knowledge or training to meet the increasing complexity and number of behavioral mental health needs of their patients. VMAP education really focuses on 4 R's: recognize, respond, know when to refer, and know your local resources and how to find other resources. By doing this, we're improving timely access for our patients, as well as building an upstream extender mental health workforce. Next slide. VMAP education is reaching PCPs through 3 main adult learning opportunities. Number 1, you've heard about REACH. This is a national program. The title is somewhat lengthy: Resource for Advancing Children's Health, Patient-Centered Mental Health in Pediatric Primary Care. So we affectionately call that REACH PPP program. This is a 16-hour intensive interactive course followed by 12 bi-monthly discussions of cases brought by the primary care providers to the trained child psychiatry and general pediatric faculty. The second program is a VMAP ECHO, the Project Extension for Community Healthcare Outcomes program. We call it ECHO, which is a year-long regional learning collaborative of about 20 to 25 participants each, and 6 to 7 interdisciplinary faculty, including child psychiatrists, who share didactics and case-based discussion over lunch hours. And the third component is quality improvement, or QI projects, to introduce and insert behavioral and mental health screening into busy office practices. Despite the barriers of the pandemic to both practices and to education activities, we have already longitudinally engaged over 310 pediatric primary care providers in VMAP education. Next slide. VMAP partners with the Virginia chapter of the American Academy of Pediatrics and the National REACH Institute, and offered 3 regional trainings in 2020 depicted here, in addition to some initial training in the late 2019. Remarkably, REACH was an in-person course with telephone follow-up, and by having to postpone all of the spring 2020 courses, it allowed the faculty to pivot and adapt the course to virtual education and teleconferencing case-based discussions, which in many ways improved quality and reduced significant participant barriers. For sustainability and to be more nimble to the unique needs of Virginia, VMAP has recruited its own 12 faculty who are completing a rigorous train the trainer course. Individuals who participate in REACH can earn up to 28 CME Category 1 credits. Next slide. As you may know, Project ECHO was designed in 2003 in rural New Mexico as a telemedicine learning collaborative, specifically intended for small groups of primary care providers to encourage regional connectedness of hub faculty and spoke participants. We completed our first 3 year-long regional VMAP ECHOs in 2020 and have started a second group this fall. We have over 17 interdisciplinary faculty supporting the regional cohorts with at least 1 child psychiatrist per cohort. This includes populating a web page with recorded sessions, free screeners, local resources, and parent handouts. A 60 credit CME MOC4 package provides needed motivation to busy practitioners. Next slide. The initial mental health screening quality improvement projects partnering with the Virginia chapter of the American Academy of Pediatrics emphasized increasing depression screening in youth through multiple PDSA cycles. There have been 2 projects so far with 80 total participants. In the most recent cohort, depression screening increased to 98% in participating practices, and you heard testimony to this today. Next slide. Along with the standalone QI project, VMAP Education embeds QI into the ECHOs. Participants choose a mental health screening tool to introduce to their practice. Over 40 providers took advantage of this in the 2019-2020 cohort, totaling 120 Virginia pediatric primary care providers who through VMAP can now demonstrate a practical way to recognize and respond to mental health concerns. Next slide. In 2021, we have another busy year planned. The virtual REACH course is already full with a wait list for the January REACH course in Charlottesville. There's others planned. There's additional faculty being recruited for the REACH courses that are grow your own model. We have launched another VMAP ECHO. We've also planned to launch an East and a West ECHO starting in January of 2021 for the year. There are new mental health screening QI projects starting and available for practitioners to take advantage of. We would like to finalize a downloadable VMAP guidebook with algorithmic approaches to mental health symptoms, free screening tools, resources for every pediatric primary care provider in Virginia to use in practice and when consulting a child psychiatrist. And we are piloting and will implement a deeper dive echoes for those providers who want to continue their work in behavioral mental health lifelong learning, such as the Birth to 5 infant mental health project, where we include the effects of trauma that was described, some projects that were described earlier by Commissioner Land. In summary, primary care provider education is one of those 4 pillars of VMAP, and I see it as the upstream pillar that fuels the program by increasing capacity of primary care and connecting them to subspecialty mental health resources. Equipping a strong and confident primary care workforce upstream results in a rising tide downstream and lifts all our boats. Thank you. Next slide. I'd like to introduce my friend and colleague, Dr. Bernadette Knight, the VMAP State Program Administrator. Bernadette?
Thank you, Dr. Davis. As she mentioned, I am the VMAP State Program Administrator, and I also co-lead the data work group with Nika Anwell, who's at the Virginia Department of Health. And I want to take a few minutes to provide some data updates for this year and also some next steps moving forward. And I just want to say very briefly, the data work group really supports the work of all the work groups in VMAP to make sure that we provide the data support and for the overall program so that the data collection, data outcomes, and ultimately the story that we say with VMAP can be shared with folks and on meetings like this today. Next slide, please. So over the past year, the work group has been hard at work examining, developing, and refining our program procedures and reporting. And we recognize that as VMAP is growing, especially as Rachel mentioned with our consultations and our call volume, we've worked to make changes to areas of call and data workflow. And really this is to help enhance the consultation experience, the ease of data entry, and also for reporting. And from that, we've also taken that approach as we do our monthly reportings to 2 things. 1, we provide the report for updates to the executive committee and our fellow work group members to let them know our progress. But 2, as we develop reports, we also take time to look, refine, and then see where might we be able to make the things that we're relaying more efficient and clear so that folks can understand the successes and outcomes that are in VMAP. goals that we have moving forward are three-pronged. One, we want to continue our cross work group collaboration. We also want to continue and more so use data in our discussions with senior leadership and with the work group leads to have discussion about outcomes, and particularly around health equity as we've started to put focus and continued focus in this area. And three, work on a framework for data governance. What I want to do now is just take a few minutes to tell you what data governance is, why it's important to VMAP, and plans for that moving forward. So broadly, data governance is a practical and actionable framework to help identify and meet the needs of stakeholders. It helps to answer the who, what, when, and where with the various processes and steps. So over the past year, as VMAP has grown, the data work group and the executive committee, we've all realized that there's a need for us to have a structure to help us all understand how to work with the data, communicate the data, and to communicate our successes. So as such, the data governance, the data work group has been working over the past year to develop this structure to help us all move along with VMAP for program administration, reporting, and evaluation. And the next two slides will go over what we currently do for data governance and also what we plan to do in the future. So as you see on this slide, our current process is a three-pronged approach. So we have monthly quality assurance checks where we actually look at the raw data that we're collecting to make sure if there's any duplicates or missing data or any anomalies like that, we can rectify it and make sure that we have accurate and reliable data. One of the best ways and we can share outcomes is to make sure we have reliable data to do so. So we have those monthly QI checks. We also have a larger monthly work group meeting where we have a diverse membership with backgrounds and contributions to data and analysis and reporting. And this is where we can really brainstorm ideas. We can also talk about where VMAP is as a program and set goals and objectives. And then from that, it also allows us the ability to break into subgroups to tackle those specific needs. And so governance is one of those subgroups that developed from this conversation to really do some deep dive into this. And along those lines of deep dives, we also have subgroup weekly meetings, and this is a smaller section of the data work group. And it sounds just like we say, we get together each week, and if there is feedback that we get from the field, or as we're examining processes, we will go through and think about what we can do to strategize and to make it to maximize that. And so one of the things, as I mentioned earlier and Rachel mentioned with the workflow, this is something that came out of directly of the weekly meetings that we had to really have some time to do a deep dive and to really explore that. And I just want to briefly say that from this process, any recommendations that are made from any three of these areas, we review with the executive committee, we explain what we're doing, why we're doing it, why it's important. And then we also work with them to get consensus on this, and then we implement and move forward. Next slide, please. So this chart, what I'll just say globally, it's what we call a RACI matrix, and it describes who's responsible, accountable, who's consulted or informed as it relates to data use and access. And so we recognize that as VMAP is growing in program and scope, that we wanted to provide a framework for all our stakeholders where you fall on the spectrum to understand the different processes in data, how we all work with the data and how we can all communicate and share data and outcomes. So this is one of the models that we're working on now to develop in our governance structure to integrate into our larger program processes to move forward. And I recognize there's a lot of information on the screen, but just want to say globally, it really helps to provide a framework for us to understand and to work with the data moving forward. Next slide, please. So next steps. In addition to what I mentioned on the first slide, our next step will also be to continue work on data governance. We want to have a goal of a working draft in 2021. Recognize as VMAP is growing, we definitely want to have things in place as it's growing to help guide us as we do our work. And the data work group realizes this will also be we'll have valuable input from the executive committee and our colleagues on the steering committee level to make sure what we are proposing is translatable in the field, because we don't want to create something that doesn't work for the program and causes more barriers than a help. And we also want it to be a dynamic document. We recognize that as it grows and things change, there'll be a need to come back and revisit. So it will be an ongoing process, but it will be one where we want to get started in 2021. And so I want to thank you for listening. And I also want to turn it over to my co-lead, Nika Anwell, who's going to be providing updates for Tina Gustin in place for telehealth. Thank you.
Thank you, Bernadette. That was a great overview. So my name is Nika Anwell, and I'm an epidemiologist at the Virginia Department of Health, and I'm a co-lead with Bernadette Knight of the Data Work Group. Today, I'm filling in for Tina Gustin, who is our telehealth lead and the director of Old Dominion Center for Telehealth Innovation, Education, and Research. Next slide, please. COVID-19 has greatly shifted the telehealth landscape. Because of COVID-19, telehealth has moved from an innovative tool that was mostly used by early adopters to a critical tool many providers are using daily. While there's an increase in the use of telehealth, many providers have not been trained or prepared to provide care in this way. Next slide, please. Our goal is to help clinicians provide high-quality virtual behavioral health care to patients. And we're doing this in two ways. First, we're developing a VMAP-specific telehealth training. We are surveying behavioral health providers to understand their current acceptance, knowledge, use, and satisfaction of telehealth. We're using the results of this survey to edit an existing telehealth training program created by Tina Center that is currently used to train primary care providers about telehealth. We will then adapt the training to meet the needs of behavioral health providers. The second thing that we're doing is we're piloting enhanced consultation. So currently our standard consultations are between a VMAP provider and a primary care provider via telephone. However, some consultations need to be more than provider to provider, and we greatly benefit from the VMAP psychiatrist seeing the patient directly via video and then following up with a primary care provider. The goal for these enhanced consultations is to provide greater support that can help the PCP continue treatment of the child, or to act as a short-term bridge to treatment while the family waits for an upcoming appointment. So we're working to build the pilot for this type of enhanced consultation, and we're excited about being able to support our behavioral health providers with a telehealth training specifically for them soon. So a lot of great things in the work with telehealth. And now I'm going to pass it back to Ali, our program director, to talk about VMAP 2020 and beyond.
Thank you so much, Nika, and to the rest of the team for the comprehensive update. I get the pleasure of working with all of these folks on a daily basis, and we have a fantastic team that's making all of this possible. But now let's look at what's next for VMAP. Next slide, Taylor. So we now know, and as we've all been caught up, we have more funding coming our way and a lot to do. Our first focus is expanding these educational opportunities that Dr. Davis walked us through. We know that the REACH trainings are in very high demand all over the country. They are offered at a cost of thousands of dollars, and there's, I think last I heard, a 2-year waiting list for that program. So here in Virginia, we're going to be able to offer those to our primary care providers at a very minimal registration fee, and we're adding more in the next 6 months as we speak. We also want to implement that regional hub model that I mentioned in all 5 regions of the state. So that means that primary care providers in any region are going to be able to receive support from their regional child and adolescent psychiatrist, their regional licensed mental health professional, and a regional care navigator to support them with referrals and resources that's needed. Next slide. This would not be possible without all of the hard work and support of so many partners and stakeholders from all over the states. We wanted to take an important moment to thank all of our partners, because without them, VMAP would not be what it is today. On that note, I'd like to conclude the VMAP specific portion of our meeting today. I'm now going to hand it off to our child and adolescent psychiatrist lead, Dr. Bella Sood. She's going to talk to us a little bit about how this pandemic has impacted the mental health of our children. Dr. Sood is a professor of psychiatry and pediatrics, past chair of child and adolescent psychiatry, and training director of the Child Psychiatry Fellowship Program at VCU Health System. She's been with VCU for over 30 years. She's the past medical director of VCU's Virginia Treatment Center for Children until 2014, when she transitioned into the role of senior professor for child mental health policy. Welcome, Dr. Sood.
Yeah, I don't think I can divest myself out of VMAP because this is a program that I have been very involved with and so happy to see off the ground. For decades, we've had mental health shortage, as access to care shortage across Virginia, across the nation. And so it is terrific that we are at a stage where VMAP, a program like VMAP is around to provide those services to folks. So we have known for a long time that mental health access is a major problem. And then upon that, you have the pandemic. So could I have the first slide? As a testament to my predecessors who have spoken before me to really sort of speak very much the slides that I had to speak about today, that COVID has become such a major transformational force in our world now. And it has really humbled humankind in pointing out our fallibility as well as the lack of control that we all experience. And I think it's this lack of control that we all experience which has translated into a very high mental health need. Certainly loneliness and isolation, which we all feel. And I think I personally have experienced this, which has led to a burgeoning amount of anxiety and depression in the population. And certainly old traumas and history of problems that people have had have really translated into an increasing amount of mental health issues from a variety of different surveys. So these slides just kind of portray some of the surveys which are available, but across the nation, people are looking at this, studying it, and really coming up with data to support this idea that it's not only old cases, but new cases of increased mental health needs across the nation. Next slide. As previous speakers have talked about, in all our wisdom, Virginia AAP partnered with GBHDS earlier in the summer and began to look at the number of pediatricians who have noticed an increase in the number of mental health concerns, and also the fact that they have reiterated the notion that they cannot take care of this based upon the knowledge that they have, and they feel that these needs are going to continue to increase. In my role as a REACH instructor, which is one of the educational tools, there's an interface with a lot of pediatricians on a regular basis who echo this and really appreciate the VMAP consultation, which occurs like within few minutes of having a patient in their offices asking for assistance. And for that, I really would like to do a shout out for my child and adolescent colleagues, psychiatry colleagues who have been so good with responding quickly to these consults that come up. And right now we have coverage for all the regions by a trans Virginia team, which covers these. We hope to have, as Ali had pointed out, regional hubs, which will then become self-sufficient to do that. Pediatricians have seen an increase in anxiety and depression, and I see that on the consult line all the time. Next slide. So mostly COVID sort of, as we have known of it, is something which affects older people, people who are immunocompromised, people who have comorbidities. But why we are talking about this so much is the interlinked system that children depend upon parents, and the isolation and the fact that contagion is brought home, the isolation that families have known, and living in close proximity, having people die, family members, uncles, aunts, grandparents, all of these have a major impact upon kids. And it will certainly continue to affect business as usual for the entire population. Next slide. And the NSSP program through the CDC has also shown that although the visits to the emergency rooms have decreased, the proportion of people coming into emergency rooms for mental health issues have skyrocketed. And that's telling because we're using the emergency room, which really ought to be meant for very specialized services, being used for mental health services. And this again talks about the need for becoming competent and capable of handling things in the pediatric offices rather than sending young people to emergency rooms. Next slide. All international studies, again, show the same thing. And I think one of the most seminal studies has shown that when people have looked at the long-term impact of isolation as well as all the things that COVID is doing the population, that it has long-term outcomes down the road which are negative, and it leads to isolation and withdrawal and perhaps new incidents of depression in young people. So we really have to be very careful in how we manage this pandemic. Next slide. Vulnerability factors, particularly in children, kids with developmental disabilities, the racial inequities that we have spoken about from in economically underprivileged populations, pre-existing mental health conditions, and as I've noted, a bimodal distribution. Generally, when children present with anxiety, they have actually welcomed being at home, avoiding the schoolyard bully, and remaining at home. But now we are seeing sort of a burgeoning increase in depression in the same population, who is really feeling the difficulty of online learning. And this is something that we have to study to get more data to see how online learning, virtual learning is impacting even very anxious kids who want to remain at home. So this is a long drawn process which we have got to study, but there are many people in our population who either present with externalizing behaviors or internalizing behaviors, and these are definitely on the rise. Next slide, please. So one of the problems is that although children are not expected to have a high incidence of COVID, they also, CDC data has shown that they have a potentially lethal multi-system inflammatory syndrome, and above all, are carriers of bringing infection back home and impacting other immunocompromised individuals in the home. So virtual learning has become a huge thing, and certainly it impacts people of color much more disproportionately than the majority population. Next slide. Of great importance is COVID and how it's impacted schools. We know that virtual learning versus a hybrid model versus face-to-face learning is really dependent upon different school groups. And school is not just a place where individuals learn, but there's also the notion of the impact it has upon your social and emotional skills, your ability to interact with other kids, particularly other things that we don't normally think of, which is food security. A lot of kids get their meals within the schools. Certainly kids with social, with disabilities and who have IEPs are on the front line for getting face-to-face services, but sometimes that doesn't happen. And these are the kids who are extremely vulnerable. They get other services like OT, RT, and most importantly, next slide, that all data shows that a large proportion of young people get their mental health services needs met within the school setting. So when they're not going to school, they're really missing out on a huge proportion of access to mental health through school counselors, etc. So these are very, very important things to consider as we look at the impact of COVID on young people. Next slide. And so I cannot imagine a better time for VMAP to be really sort of on the rise here. We are seeing a steep curve in the services that are present. We have a wonderful team, a very strong infrastructure, which is moving from strength to strength. And it couldn't have come at a better time than having this pandemic here and having a solution in the form of VMAP with all its 4 pillars in here. And we're going to continue to see an increasing amount of these problems come up. It's going nowhere. And we are seeing from data that we now in Virginia are really structured and really at a very good point poised to tackle this. And I really wanted to thank the Governor Northam and Secretary Carey for your leadership in really going through the pandemic in a way which has been level-headed and has helped Virginia move in the right direction. And we as VMAP are going to be great partners to the state in handling this problem with mental health concerns, which are on the rise. But I promise that I feel confident that we have something in place which is going to tackle this issue. Next slide. With strong partnerships, which amongst all of the people who have spoken today, who interface with kids. Onwards we go, and thank you so much.
Thank you so much, Dr. Sood, not only for that presentation, but also for all of your contributions to VMAP since really it began. It's now my pleasure to introduce our Secretary of Health and Human Resources, Dr. Daniel Carey. Prior to his appointment in 2018 by Governor Northam, Dr. Carey worked for over 20 years as a cardiologist in Lynchburg and served as Senior Vice President and Chief Medical Officer at Centra, where his responsibilities included information technology services, patient quality and safety efforts, performance improvement initiatives, and functions of the medical staff at Centra's 3 acute care facilities. He has a special interest in medical leadership, and in addition to his roles at Centra, he's also served as the president of the Lynchburg Academy of Medicine, our very own Medical Society of Virginia, and the Medical Society of Virginia Foundation. Dr. Carey received his medical degree from Harvard Medical School and his Master of Healthcare Management degree from the Harvard T.H. Chan School of Public Health. Thanks for joining us today, Dr. Carey, Secretary Carey. It's a pleasure to have you on.
Well, thanks so much, Allie. Can everyone hear me okay? Good. Well, thank you. One of the best parts about being on a little bit early is I got to hear only the tail end of Dr. Davis's comments, but thank you. And also Arami and Bernadette, as well as Dr. Sood. So thank you for that opportunity. And I'm so excited. It's kind of like, I forgot the movie, maybe Jerry Maguire, when I first read the prospectus about what VMAP was. It was like, you had me at hello. It really was an incredibly powerful concept, leveraging primary care offices with expert resources. And then when needed, that second phase of getting an individual with a psychiatrist or other behavioral health professional as soon as possible if needed. So again, I'm really excited about the continued progress and so impressed that this progress was possible during the pandemic, which has been a challenge, as you know, in really every aspect of normal life here in the Commonwealth. So thank you for this opportunity. I really want to cover three things. One is the COVID-19's impact in Virginia on children from a high level. You've been talking about it, but I'll go into a little bit of depth. Second, what the Commonwealth response has been, and then talk a little bit about what Dr. Sood had mentioned, the impact of virtual learning on our children, and then some concluding remarks. So thank you so much for this opportunity. And I know you've already heard from Commissioner Allison Land, and I saw a moment ago, Nina Marino, the Director of Child and Family Services at DVHDS earlier. So we really appreciate their leadership and their work on the priorities within STEP Virginia and behavioral health enhancement and what that will mean and does mean for the Commonwealth. And I am so fortunate to lead a stellar team. I think you also heard from Commissioner Oliver, who I've spent an ungodly number of hours with virtually or some socially distanced, but face-to-face across the room in the last 10 months. So I know you've heard from his team as well and the data work that's being done out of VDH. So before I say anything further, I just want to thank this group for all that you've done to protect and serve Virginia's children under these most difficult times. I don't know where we'd be without you. There are challenges and all the needs we know are not met, but I couldn't imagine where our children and our families would be without the professionals on this call and the teams that you represent. So thank you so very, very much, really going above and beyond for some of the most vulnerable individuals, our children, especially those with behavioral health needs in the Commonwealth. So thank you again for those services. And also, I just heard about, and I'd like to acknowledge the expansion of VMAP services across the Commonwealth and included in the plan and was included in the special sessions budget. So we really appreciate our teamwork with the General Assembly supporting this important initiative. And the partnerships, I think that was mentioned on Dr. Sood's, one of her last slides, and how important that term is and those partnerships really are. And the partnerships represented on this meeting today and of all of you present for the life-changing services that you all provide and for the well-being of Virginians, families, and especially children. And I know it's consultation call-ins, it's increased educational programming. We heard about that from Dr. Davis, as well as care navigation services. So thank you for all the impact. What a major step in the right direction that this is. But of course, we have more work to do, and especially when it comes to increasing the workforce to meet the mental and behavioral health needs of Virginia's children and families. Virginia ranks 41st in the nation for its mental health workforce, including child psychiatrists, psychologists, social workers, and therapists. And I don't need to tell you that because you know that your sister and brother clinicians are all too thin to your left and to your right. And while we are hard at work stopping the spread of the virus, we know that the virus does not just affect the physical health of our communities, but has exacerbated and been a bigger stress to the mental health, behavioral health of our communities. So the policies and safe practices that we have put forth have had a demonstrable effect on the mental health and social well-being of Virginians, and we have committed to a health equity approach in all of our decision making. And in the Office of HHR, we believe it is the responsibility of the Commonwealth to protect the public health, wellness, and prosperity of all Virginians, especially our younger residents. And that has entered into our decision making. If it was only public health and economics, we do balance those goals because we know that some of our policies could have a negative impact on, and do have a negative impact on employment, which in turn has an impact on health and food security and transportation security and the like. Nationwide, the COVID-19 pandemic has exacerbated all those conditions for our families and has increased the number of adverse childhood events such as job loss, food insecurity that I mentioned, housing instability, while increasing risk for parental mental illness, domestic violence, and child maltreatment. I'm going to step away. I need to get a sip of water. I'm sorry, I've got a little scratch in my throat. Excuse me. Well, you may not see that every day with a speaker, so thank you for your understanding. So, and I wanted to also underscore that when we talk about vulnerability, there's no doubt that Virginians of color bear a disproportionate impact of all of the stresses of COVID-19. And I want to quote from a recent Richmond Times-Dispatch article that came out this week about the surge of health needs in Black and Latinx children here in Richmond. And I quote, "Since the outbreak, depression and anxiety have run rampant across the US with an August Centers for Disease Control and Prevention study indicating that 1 in 4 young adults have seriously considered suicide in the past 30 days. Black and Latinx respondents were at least twice as likely than any other group to report the same," end quote. So the pandemic has led to a fraying of those crucial protective factors, such as community networks and emotional supportive adult relationships that have proven to shelter children from harm. And those are disproportionately felt in communities of color. In Virginia, referrals to child protective services by school staffers have dipped by 94% since schools closed to the pandemic and have had either virtual or hybrid learning since then, which may mean that children and families are not being connected to the supportive services that prevent child abuse and neglect. So that is an incredibly worrisome statistic. Telehealth has been an invaluable tool. It's been mentioned already this morning in preventing disruption to care, which we'll continue to do, and we will continue to do everything we can do to maintain these flexibilities beyond the pandemic to support Virginians, families, and patients of all ages. And I think that's really one of the most powerful lessons that we need to learn and integrate into our systems going forward at Medicaid, the state health plan, leading the way for commercial coverage. We know that gone unaddressed, pandemic-related childhood trauma could have long-term and wide-ranging negative and economic effects. And as families navigate through their financial, social, and physical well-being challenges, Virginia has responded with the goal of delivering innovative, trauma-informed, wraparound services to promote health and safety. And we know those efforts have been incomplete, but they have been significant, and we need to learn from those impacts as we come out of this pandemic in the months and perhaps year or two ahead. Now, I've mentioned some of the elements of the response. The major focus of the Department of Social Services as it responds to COVID-19 has been to maintain partnerships with local departments that administer child welfare and benefit programs, ensuring continuity of robust communications with benefit recipients and providing supports to parents and foster parents. Establishing service continuity has required DSS to find innovative methods by which to provide those services, for example, with debit cards and the like, to give much more flexibility to families to provide for the needs of children and the entire family. Through a lack of access to technology, though a lack of access to technology poses a barrier for some, virtual visitation has largely been successful. And many reports have found that families have actually maintained greater connection than prior to the pandemic, because it required less travel and often less time. And those are lessons we need to learn and again, integrate into our future efforts. Now, virtual learning, we've talked a little bit about that. And as schools gradually begin to resume in-person instruction, I think that's not really this week as we look at higher and higher infection rates and we try to maintain face-to-face learning. But as we come out of this in the months, likely not weeks ahead, we need to, again, understand the potentially traumatizing events that students and their families have experienced and are experiencing related to COVID-19, including grief from loss or fear of physical or emotional abuse and lack of access to food, shelter, and medicine. And Virginia is already one of several states partnering with the Collaborative for Academic, Social, and Emotional Learning, CASEL, to develop standards and competencies around SEL, social and emotional learning. So that's an important initiative. And in response to the pandemic, the Virginia Department of Education has prioritized such skills in the learning environment and disseminated those resources around SEL to both educators and families. And as referral rates for Child Protective Services also have declined precipitously because of teachers are the #1 referrers to those services, VDOE has also provided resources for teachers to recognize signs and indicators of child abuse through virtual learning. So VDOE is committed to ensuring that students return to school in a healthy and socially and emotionally supported manner. But we know that's a challenge. The Commonwealth's Return to School Recovery Task Force developed a guide for school systems called Recover, Redesign, Restart 2020 in preparation for school reopening. And we may need to change that to 2021 because obviously it will continue throughout 2021. So the guide centers equity-related considerations and strategies with the acknowledgement that inequitable access to technology, learning supports and resources disproportionately impact children and youth from marginalized communities. And equity-related return to school strategies include developing measurable equity-related goals, conducting a return to school planning equity audit, developing family engagement and student support approaches that are culturally relevant, and reframe discipline and the reframing of discipline policies to mitigate against bias. So those are some of our efforts around those 3 topics, but I thought I'd finish again by thanking you all for all that you have done in your clinical work. I couldn't imagine where Virginia would be without your work and this incredibly important initiative. I'm just so excited and appreciative of the progress that's been made despite the additional barriers of the pandemic. And the last point I want to make is that this has been a traumatic time for all of us. And I think caregivers as a group, and though I'm not in a caregiving role, I still have that deep in my, really the foundation of who I am. And I think we're not particularly good at seeking help ourselves and not acknowledging that we're human. And that way we may be having signs of burnout, signs of emotional stress ourselves. And I'll just share a little story. As my life as a busy administrator just before coming here and some clinical work, and then a full-time adult, not pediatric cardiologist and vascular medicine specialist. I had periods of time where I wasn't sure what to do. I wasn't entirely clear, and that's stressful. But I will tell you that I've never had a period of prolonged uncertainty with profound responsibility like this one. And I had the great pleasure and responsibility of briefing the governor every day for 12 and a half weeks. So going into May, I knew something wasn't quite right, but I couldn't sleep as well as I used to. I had no time for exercise. I was able to meditate twice a day, which I've done since I was 16, but I was clearly stressed and I wasn't sure what to do. And, being maybe it's part male, maybe it's being a physician myself, a caregiver, maybe I'm of a particular age that I wasn't likely to reach out. And I remember right before Memorial Day weekend, I reached out to both the governor and the chief of staff and said, I'm not performing at my best. I need help. And I am so grateful for the chief of staff said, Dan, we've been feeding off your positive energy for 12 weeks. You need to take a break and you need to lean on us and you need to let us lead for a little while. And kind of acknowledging that I needed help. And for me, it was 3 or 4 days off that long weekend, got some exercise, spent more time with my family, and maybe had a chance to reframe. It was really about the mission, and maybe I took on too much on my shoulders, and I needed to really rely more on others. And it really was profound. And as a leader and as a physician, I realized in a very profound way, something maybe I knew in my head, but I didn't know in my gut or in my heart, that one of the most profound leadership activity is to ask for help. And what a great example that turned out to be. And it really turned things around and how important that was. So I mention this not because I'm unique, but because I'm like everybody else. I am responding to the stress, especially uncertainty over long periods of time. And I just wanted to encourage you as caregivers to think about your own lives, think about opportunities to connect, to share your own vulnerability, to reach out for help, because it is profound. And in your roles as a caregiver, what a wonderful message that sends to all the people that you lead, that we are all human. We all are bearing incredible stress from this pandemic. And how might we together turn rather to post-traumatic stress, but to post-traumatic growth, because we learned about our own vulnerability. We learned to move perhaps with more humility in our caregiving and in our leadership activities, and how we might learn profoundly from this experience, even as we confront incredible challenges. So thank you so much for this opportunity to share with you all today. And again, I appreciate all. I can't wait to see the continued outcomes from the further development of this program that will be so important and is so important already to so many Virginians. So thank you very much. And I don't know if the schedule will allow for any questions, but I have 5 minutes before I have a 12 o'clock that I need to get to. So I'll go with whatever the program needs are. But thank you.
I think Secretary, we really appreciate you being on with us today. If you do have questions, again, use the Q&A function. We will try to get to those before the conclusion of the meeting, but we will move forward here, and it's our pleasure to introduce Governor Northam.
And I think I'm introducing, yep, here's the governor.
I'm Governor Ralph Northam. Thank you for inviting me to join you today. While we all would like to be meeting together in person, safety is paramount, and I am grateful to all of you for doing your part as we fight the COVID-19 virus together. As a child neurologist, I know how important mental health is for our children and our families. The Virginia Mental Health Access Program plays an important role in connecting children and adolescents to mental health assessments, diagnosis, and treatment. And with recent data showing an increased need for pediatric and adolescent mental health treatment and services and not enough provider capacity, the VMAP model is very important. Prior to the COVID-19 pandemic, less than 10% of primary care physicians surveyed across the Commonwealth said there was adequate access to child mental health services. And 65% of pediatricians surveyed nationally reported they lacked mental and behavioral health knowledge and skills. And we know the pandemic has created new challenges, burdens, and stressors for many Virginia families. This has resulted in increased rates of anxiety and depression among our children, youth, and their caregivers. It's clear that expanding this workforce to better address mental health conditions in children and adolescents is important for our communities, and VMAP is a key part of the solution, serving as a critical resource for pediatric patients and for primary care physicians across our Commonwealth. I believe there is tremendous power in every child, and I know how valuable it can be for children to have access to care and services in their communities and with the providers that they trust. That's why I'm so proud of the work this program does and all the people who support it every day. Our administration will continue to champion VMAP and its efforts to connect more children to vital mental health services. So thank you for your hard work, dedication, and continued partnership as we work together to improve the health and well-being of all Virginians.
Great. Thank you so much, Governor Northam and Secretary Carey, for all of your fantastic support and your ongoing support of VMAP. It has been a whirlwind year, to be sure. And I did want to share that one of my favorite hobbies is boating on our Virginia lakes, and the pandemic's been a great time to take on that hobby even more. I had heard a quote from a sailor who had said, "I cannot change the direction of the winds, but I can adjust my sails to reach my destination." So again, I can't control the direction of the wind, but I can adjust my sails to reach my destination. And 2020 has adjusted the wind over and over and over again for all of us, and even to hurricane proportions at times. So VMAP has done an amazing job of adjusting our sails so that we still reach our destination. I thank you all for spending your morning with us and for all your work on VMAP over the years. I look forward to seeing you all in 2021. We do have an opportunity to answer some of the question and answers, which Allie will lead, but we do understand that if you need to hop off, feel free to do so. And again, thank you so much for attending.
Thank you, Dr. Chung. I am again, a pleasure and an honor to have everyone on with us this morning. I think, unless my team has other knowledge than I, that we have answered or gotten to all of the questions that have come through. If we've missed anything, please email us. Our contact information is on the screen. We want to be mindful of everyone's time, and we know we packed a lot into 2 hours, but certainly reach out if you have any questions. Thank you for joining us, and this concludes our 2020 VMAP stakeholder meeting.